And welcome to EMS Underground, where Facebook is catching up with me. And I am Charles McFall, the host today. I'm media specialist here at Georgia Institute of EMS. Excuse me. And I'm getting everything set up as we do. But today I've definitely got some set topics. I definitely know what I'm going to want to talk about today. I was able to help out with National Registry this past weekend. And so I'm going to give a little something of a encouragement to students. You know, obviously we don't talk about what happened at the test or specifics or anything like that, but I will be talking about some observances. I finally got to observe students in action and give some tips on how this goes down and give some reasonings and some mentality behind it that I'm not always able to do while we're doing that. Then the other thing is I had some conversations with some people in the field. And one, I want to give some shout outs to Paul Crumplis. Good to see you again, man. Jeremy, finally got to meet Jeremy himself. I think it's Jeremy Webb. Not Jeremy Webb. Jeremy Webb's the IT guy. I got to meet Brian Johnson. That was really cool. I got to meet some other people that are instructors there that I just see the names pop up in the groups and whatnot. And big shout out to Amy Norton. Love to have you. I'd love to have you on the show. I didn't get a chance to say that yesterday, but I'd love to have you on the show and discuss our history together. You know, the path you took as a woman through EMS. You were a nurse and you were an EMT, and then you did the flight medic, and what you're doing now, and the instruction that you've given. Man, I used to love talking to her. I've worked with her and her mother. You know, it's one of those things where you meet somebody early in your career and you kind of keep in touch. I mean, some relationships are made, right? Some people stay working, some people stay connected as friends, and some stay friendly. And I've stayed friendly with a lot of people, including Amy, and it was good to see her again and talk to her. But we had some conversations, and so I've got an idea for a topic about how to help relations between services when you don't work at the same service, and it's going to be hopefully interesting. But right now, I am doing the share on Facebook as I do, so you have to bear with me as I do that. We're talking about EMS testing and actually, it's not even about testing. It's about entering the world of EMS, and I don't know, man. Making a good path. You know, I'll just say relationships, whatever. Relationships today. All right, hit post. Going to do that. Everybody can do that as well as you're watching this, either if you're watching it live or later. Shares, likes, hearts, all that jazz is always a good thing. So I hit love because I love doing this show. So testing itself was an eye-opening experience. It's the first time I've been on the other side of registry. Maybe ever. I've done some local testing with National when I worked with National EMS. I helped test some of their students and those kind of things, but never the National Registry. And didn't know any of these students. Came into a building full of really nervous people. I'm like, man, I remember those days. I remember those days of, you know, people around me going, "Oh, we're going to pass." When I went to EMT school, I had nothing to lose. Right, I had no concept of what the field was like. I had no concept of losing anyway at that point in my life. I always passed everything the first time. I was an excellent student. And because I had nothing to lose, I didn't really care. So I wasn't really nervous. And my teachers actually pushed me a little bit harder in the testing, maybe because of that. But I was relaying this story. The only thing I ever messed up so when I went through EMT school, there was intermediate EMT, EMT-I. EMT is emergency medical technician, so EMT-I for intermediate. And then there was paramedic, and that was it. They've had different levels before that and different levels after. Now, currently, there's EMT basic, so EMT-B. Then there's advanced EMT, which is not EMT-A, as you might think. It's AEMT. Stupid. And paramedic. So it's just the way, just come on, keep a common naming system. Right, Carl? Carl, you're watching. BC Dodge is watching. You know, keep a naming system. That's all we're asking is a naming system. Don't change it up every few years just because you're being weird. So this was, I don't know if this is for advanced or for basic, honestly. It was just National Registry, and people from all around came to this school. You don't have to go to the school to be tested there. If we're a testing site, you can come from other schools. And man, there was just this air of nervousness, and I really wanted to go in, not knowing necessarily my role. There's a lot of instructors there. Some like me who are uniformed up. I'm officially with the school. Some were just medics and friends of the school that were helping out, and that kind of thing. And so I didn't quite know my role. So first test I've gotten to help with, but I wanted to go in and give a little speech. And maybe next time I'll talk to Tom ahead of time and be able to do that, because that's part of my job, right? I'm just a media specialist. So I'm here to talk to people, to entertain you, to take the mystery out of the business, to get you a grasp of reality of going into the field. So I wanted to go in like, hey, did anybody kill any homeless people on the way here? Did you run any kids over? No? All right. So if you fail this test, it's no big deal. You didn't kill anybody, so you're going to be good. The worst thing that happens is you get to see our shining faces again. Breathe. These are easy stations. The hands-on stuff is easy. Just do the list. I'm sure they'll provide you a list at that time, and most classes provide you a general checkoff sheet to memorize. So make sure you hit these steps, because there are things called critical fails that if you miss this certain step or you do this particular one step out of order, you automatically fail. It's typically, PPE, personal protective equipment. They're calling it some other things, but basically BSI, those kind of things. So that is usually a critical fail. Back when I did it, if you didn't check the airway first, if you had to check ABCs and you didn't do the airway first, you went to a pulse first, you automatically failed. I'm not sure, because things do change. So I'm not sure if that's how they do it now or not. In some stations, including mine, you get a scenario which says, hey, all this is done. You've checked ABCs. Everything is fine. Here's the complaint. We just want to see this one thing that you do. Is it a backboard? Whatever. If you're doing the airway, you just go in, verbalize, I've checked this and that and the other. And then because they really are just testing to make sure you do manage the one specific thing correctly. That's what the station is. And a universal thing that I saw almost across the board, and I did go out and say something about it, is students are afraid to get handsy. And we never had that problem in my class, ever. I mean, we were a very cozy bunch. There's only about 14, 15 people in my EMT class, I think. We graduated 10 to 12, somewhere in there. So we stayed together for the whole time. And we were always, grabbing each other. We didn't do the whole... I'm gonna verbalize checking for women. No, we patted people. Now, we didn't grope women or men or anything like that. We weren't sexual deviants or crossing lines, as it were. I mean, you're not a sexual deviant if you grope a woman. I mean, you're morally wrong and legally wrong. But guys like girls, girls like guys, guys like guys, girls like girls. Whatever. I don't know why I said sexually deviant. It was stupid. I was thinking creeper. We weren't creepers. We weren't like, but we absolutely hold C-spine. We absolutely were. I'm checking, palpating the abdomen. I'm rocking the pelvis. Depending on the scenario and the injury, I'm checking the legs. We had no problems getting close and personal. These students would come in nervously, and I would, as I noticed that, I would say to them, okay, you're going to do one thing, listen to because I had a partner. I was the patient. The partner was the proctor. And I said, pay attention to what he tells you, but breathe. This is probably the easiest station you've got all day. One, because I'm in it and we make it easy. But two, because I'm not going to tell you the station I had. I honestly don't know how much details I can give from the testing, because we couldn't Twitter, Facebook. It's a thing to keep the security of the test, the safe, and information, blah, blah, blah. But so I won't tell you what we did, but basically I would tell them, get your hands on. It's fine. What you're doing is a hands-on skill. You're going to have to touch me. And people would they'd stand back. They wouldn't want to get close. I'm a big guy, and what they had to do is that, depending on the size of the person, to fix what they had to fix, they had to give me a bear hug every once in a while, depending on factors. And they just, I'm so sorry. I'm like, it's fine. Do your job. And so after about 3 or 4 students going through that and seeing that, and even if I'm telling them, it's fine. Just do your job. It's cool. We're trying to relax them. We're trying to, make them let them breathe, those kind of things. So there definitely were multiple types of students, right? There's the super nervous ones, but they do a good job. There's the ones who aren't nervous, but they're so concentrating on what to do, they can't do the job. I mean, most everybody did a great job. Don't get me wrong. So I go out to the front lobby, and I'm still bigger than most everybody there. So like everybody's kind of talking quietly. I was like, "Can I get your attention, please?" I didn't ask permission. Nothing. I just went out there. I was like, "Hey, everybody, listen up for a second." And EMS is an invasion of personal space. That is your job. So to test here, I ain't going to need you to do that. I'm going to need you to put your hands on me. I'm the patient in the particular scenario when you come to X station. If you get, because we had two doing the same thing, so not everybody came to my station. But I was like, that's what we do. And I'm going to tell you straight up, the patient does not care. Most family members do not care. They're glad that you're here. And whether or not you believe you're the expert, and right now in this room, you don't believe you're the expert, and you got to fix that or you're not going to pass the test. You're the experts. You're just doing this for the paperwork to say, yeah, I'm the expert. I'm here to save your life. So the family members, the patients always see that. That's why, I mean, the old joke is, a person with a lab coat can walk into your room at a hospital or a doctor's office, and you'll let them do whatever they want to you within reason. I'm not saying they can rape you or anything, but I'm saying, you see how people come and get information. It's all TV is a crutch, I know, but somebody just puts on a lab coat and walks in your room and starts asking questions. You answer them because they look like a doctor. They belong there. You're expected to have them help you. And so I was trying to convey that to these students is, now you're going to have to get personal. I mean, I told them I'm a big guy. What you might have to do in my station, you might have to get this close to my face. You might have to hug me. You're definitely going to have to touch me at some point to do what you have to do at my station. So just have fun with it. Just breathe. Talk through it if you can. And I understand a lot of students. And I told this to my partner, the proctor. I was like, I kind of want to say, what are you doing? What are you doing? Why are you touching me? As a patient might do, because part of our job in EMS is communication. I mean, why do you think I do everything I do? I learned a whole lot of communication. I learned a lot of lack of communication growing up in the church and seeing the business of the church. I learned actual communication in the field of medicine, because our job is not just to say, your arm is hurt, I'm going to fix your arm, or give them the medical details. Our job is to take their mind off of it as well. So you can talk to somebody while you're doing their job. Now, however, and I told my partner this, I was like, I want to say something to him because it's in my nature to educate, to get you ready to get on the street, to have you ready to do this in real life without you having to do a dozen, 2 dozen to 100 of these before you're comfortable. I want to prepare you to go out and be comfortable running your mouth, because that is your number one tool. Is talking is, oh my God, there's been so many times, and we'll get back to the speech with the students in a minute, but there's been so many times in the field that I have seen the patient get worse, the situation get dangerous, because either a medic won't talk, and I use medic loosely as a medic EMT, just the person on the ambulance, where the tech won't talk to the family of the patient, even when they're saying, what are you doing? They're just doing it. And it's bad. Communication is everything. Now, I'm not saying, again, I never said, well, I believe you have this going on, so I'm going to stick this needle in your arm and push this medicine, and this is no, but just like I do here, just like I do when I'm sitting here sharing the show, doing something that nobody wants to hear about on the podcast or on the video, going, oh, sharing and like, well, that's just how Facebook is set up. But so since I have to hit that speed bump every single time when I get going, I talk about it. I talk through it. Hey, I'm sharing it. Here's what I'm doing. But I keep talking instead of having you stare at the top of my head, because I'm looking down at my keyboard. And I keep talking because it's stupid. I hate, even on Facebook Live, I hate when somebody goes live. And and that's why I pick on Facebook Live specifically. I get that with Facebook Live, you can only prep so far. You cannot get everything ready before you go. But I definitely hate sitting there for 5, 10, 15 seconds, 20 seconds in silence, staring at somebody while they're looking off at the computer screen to the side and or looking down and typing. Because you're like, well, it's only 10 seconds. Yeah, hold your breath for 10 seconds in silence and see how long it takes. Watch a clock. Don't count it. Watch 10 seconds. 30 seconds is a really long time. A minute is a really long time. I picked this up hosting trivia, is I'll give a minute warning on people. And a lot of times they'll come running up, oh, you got a minute left to turn in your answers, as we'll say. And sometimes they come running up. Well, some don't. And I'll be sitting there like, man, is this song not over? And I'll click. Only 30 seconds has gone by. Because when you're waiting, when you're doing nothing, when you're just seeing no motion, no action, no communication, time is longer than it seems. Now, the opposite is true, too. I got busy working on the computer the other day. 3.5 hours went by. Just like that. Just gone. Because I was trying to figure stuff out and I wasn't paying attention to time. All that happened. So getting back towards the speech and the testing. Part of our job, and one of the things I was obviously really good at in the back of the truck, was talking to the patient, telling them what's going on. I was like, hey, I'm going to start an IV. It's just for precautions, blah, blah, blah. So as I'm preparing things, I'm asking them about the rest of their life, or I'm talking to them about whatever I can latch onto to talk about. Just turn on the sound. Computer users now expect responses from a computer in about 1/3 of a second. Yeah, yeah, last week it was kind of silent for 15 minutes. It killed me. Now, that's true. You guys are right. And I addressed that last week where my brain was tired and you're missing. This week I made sure the sound was on. And, it is what it is. So, screw you guys. I'm going home. Anyway, but that is something I am working on getting. Working is too strong of a word. I have said yes to the notion that I can get my paramedic numbers back to get my teaching certificate so I can help teach classes. But I don't want to just teach. I never want to just teach. Here's how you splint. Here's how you combi tube. I want to teach communication, and I can do it in those classes easily, right? As I'm talking, managing the airway, you're going to constantly talk to your partner. That's such a stupid Hollywood fantasy of the best teams can know what each other's thinking and they just work in silence. No, there is no such thing as silence in EMS for any reason. There's road noise, there's screaming, there's sirens, there's the monitor, there's all kind of noises, and you're always talking to each other. It is loud and chaotic. But when it's not super chaotic in the case of a CPR, when it's loud. But the only chaos is the panic they're feeling, the unknown of what's going on with their injury or their illness. You talk to them. So back to the speech, I felt that drive, right, that urge to encourage them to talk. But I did realize if I said that to them, say, hey, you really need to talk to the patient, just communicate, just connect with me as a person. That I felt like with the nervousness that a lot of people had about test taking, and the nervousness, they're thinking about that sheet in their head. What are the spots I have to hit to make this, to pass this thing? When they do that, I understood throwing another layer on think about talking to me would throw them off. So I didn't say all that. So what I did actually say was, let's get personal, baby. You touch me, man. That's what I'm here for. I'm literally just like the patient. I want to know you know how to do this. So put your hands on me. Get close and personal. Because there are going to be times when you run 5 calls in the middle of August, and I don't know if you can hear the fan noise because I didn't turn it off. I got a fan blowing because it's freaking the middle of August in Georgia. And sitting in a non-air conditioned room, you sweat. You think running 3 calls out in the heat, 5 calls out in the heat, even if you're just walking from the ambulance to a scene, or some places are not covered, so you're walking in the sun, taking your stretcher to pick up a patient and take them back to your ambulance. You're sweating. There's no way you're going to get a shower in between every call. There's no way you have that many clean uniforms. You stink at a certain point. It's just fact of life. But let me tell you something. Nobody cares. Well, as your partner, if you think Axe body spray is a shower, that gives you a pimp hand to the face. I put some powder, pap, go get in the shower, asshole. You do not put Axe body spray in my truck for any reason. Oh, I hate it. I worked around somebody who literally thought that was a shower. They would come in smelling like they hadn't showered in days, and we got a call, and they stand in the corner of the day room, which is where everybody sits from all the different crews to watch TV and eat their lunch and stuff, and just shh. And I complained to this. I was like, that can't happen. That can't happen. That's horrible. So take ice packs. You know what? That's never a bad idea. Now, here's what actually, Laura, to go off on a tangent, Laura says, it's hot today. I should take ice packs to the EMTs. Here's what EMTs in my company we always did was at the beginning of every shift during the summer, National, I almost said nausea because I saw you pop it up. Yeah, it makes me nauseous too. And it can definitely affect patients. And there definitely can be allergies to it. So it's a load of horse crap for somebody to be allowed to wear all that. Or perfume or cologne. Anything that has super strong smells, that's not cool, man. Anyway, what should happen in the summertime, National always had ice makers at least one station in each county, and you go fill up your ice chest and make sure there's water in it for if you have to stand by on a fire, if you're on a wreck on the highway or anywhere out in the sun for any length of time. Cold waters. Make sure you have a load of towels that stay dry, but that you can put in the ice to make cold, not compresses because we have chemical ice packs for that, but for the firefighters and EMTs, the people working, cold water, towels to put in the ice and make them cool, those kind of things. It's supposed to happen. I don't know if it does, but it's supposed to every day. So back to the students, I gave that word of advice out there. I went back to my station. The next guy who came in the test went, man, that was an inspiring speech. He's being funny. That's an inspiring speech. And he gave me a big old hug. It just laughed at me. Made me laugh so hard. Like, but that's what I'm talking about. No fear. Because I'm sorry, excuse me, I'm sorry. I get that's the politeness built into you. And it's a good thing that your mama taught you to be polite. It's a good thing your daddy taught you to be polite. It's a good thing that naturally you're not just this far away from my face and invading my privacy. However, for your job, you're going to see a whole lot of people naked that you never wish to see naked. Even the people you wish to see naked, if it's in the scenario of EMS, you're not gonna enjoy it. No, none of the nudity you get is good stuff. You're gonna have some nastiness on you, body sweat, their body odor. I've told that story. I'm not gonna go into it again about carrying a guy out of the woods and reeked like he did. Piss, crap, vomit, bile, lung butter is when you get backed up in the lungs, and when they cough it up, it's phlegm and stuff. But it's as nasty as it sounds. And honestly, there's not much that makes me sick. Depending on the scenario, I can handle it. I'd rather not. I'd rather not deal with vomit if I can help it. But I've definitely had the truck run wet with vomit in the back of it, and you just deal with it. Funny story though, this whole lung butter thing, that the phlegm in your chest, for whatever reason, that triggers me. And I can deal with it. Like, it makes me nauseous. It makes me like, because doing the suction, usually they're unconscious. You do the suction, and you feel the suction canister is clear for a reason, so you can see which is. Literally, as a brand new EMT, we consciously, it wasn't an intubation, it was a gastric tube, because the guy overdosed on whatever. So he put a tube down. So of course he's gagging and all that jazz. Like, oh, that kind of set me off a little bit. One little speck of like phlegm hit my glove, and I was like, whoa. And I don't know why that's what set me off, but that set me off. Anyway, so the guy gave me a hug. It was funny, and it did seem like some people took it to heart, and some people didn't. They still apologized. But that's what I'm trying to communicate to all new students is talking is good. Understanding and commiserating, maybe making that connection like, no, I understand this is awkward for you, but the more awkward you are, the more awkward it makes them. Confidence, even fake confidence. Confidence just to come in and not let them know that you feel weird getting in their space. Confidence is coming in and hiding the fact that if you hawk a loogie on me, there's a good chance I'm going to vomit right in your face, especially if you do it on purpose. I'm definitely going to vomit right in your face. They don't need to know that, right? That's need to know basis. So definitely, yeah, Laura, you said earlier, practicing scenarios is a good thing. We did that all the time in our class. I don't know what classes nowadays are doing, how much time they have dedicated to it. We had extra time dedicated to it because we had an extra 3 months that weren't necessary for the curriculum at the time to become an EMT. So we spent an extra 3 months of hands-on practice. But yeah, you got to get close and personal. I have no problems doing that. I mean, I'm debating on sharing a story. I'll share this story, because this is the time I refuse to get up close and personal. So a partner that I had that I hated, she was uncooperative with me. Let's just put it that way. We were oil and water, And every once in a while we got stuck together because that's just how life goes and how EMS goes. And she thought it was fun to torture me. Now, I'd already been building a sense of I'm a human being. I can breathe. It's all good. So screw you. I'm a human being. I'll treat myself that way. We got a call to a truck driver who'd stopped at one of the truck stops in the county, rest stops, whatever. And he had a goiter on his groin, let's put it nicely. And basically it's swollen, it was hurting, and his nuts wouldn't stop hurting, basically. And he said he'd stop by a doctor. As truck drivers do, they stop by a place, and the doctor told him what they had to do, but he didn't have time, so he got back in his truck and kept going. Got as far as us, and it just couldn't stand it anymore. And so we're going to take him to the ER. So I said, okay, hop up on the bench, because I already knew I was going to tech. She's already like, you're teching. I don't, whatever. You think a tech is when you get in the back and you take care of the patient. You think that's torture, you're in the wrong damn business. So whatever, I'll do it. I don't have a problem. I ain't scared. And we get back there, and of course, I'm not going to look at, what am I going to do? Yep, that's a goiter. Yep, your nuts are swollen. What am I going to do? Even if it's an open wound, there's nothing I'm going to do. So I did. I was like, we're 10 minutes from the hospital. Jump in, buckle up. And I didn't even put him on the stretcher. I put him on the bench. And I took some basic blood pressure, vital signs, whatever. Had my report written by the time we get there. And she goes, you didn't expose and inspect it? I'm like, in certain choice words, I said, no, I did not. And she tried to make a deal out of it. And even the supervisor was like, you just need to stop. It's only because it's him. If you wanted to expose and expect it, then you should have been a tech yourself and gotten back there. But you're just trying to make a complaint because it's him talking about me. So she was an idiot. But no, I refused to get up close and personal because there was no need. There was no need for me to tell him, okay, drop your pants, let me see what you got. There's nothing I can do for that. If it was, see you, Laura. If it was an open wound, I would have seen it because I did examine his pants. I looked at where he's sitting. There's no wet spot in the pants. There's no wet spot on the bench. He's not leaking. Therefore, there's nothing I can do. That's it. We're going to leave it there. So, yeah, up close and personal is what we do. That's the bread and butter. But it goes with communication. Always be talking with your patient. And if you can get them talking instead, that's better. So you can ask questions, especially, man, in the South with everybody's religious. Most people are religious. So especially I'm thinking of ladies who get uncomfortable around men because you're already feeling bad. And I do have to kind of look at, I'm sorry, I'm going to have to touch your belly. You're uncomfortable with that because I'm a strange guy. There's certain inherent uncomfortablenesses that happen. But you get up talking about, hey, you go to church around here? And usually you keep asking different questions. You'll hit on something that gets them talking, and you get them talking, and they feel better because now they're not thinking about the awkwardness of what's going on. They're not focused on the unknown of their issue and why they had to call the ambulance. It's all good. So the other thing I want to talk about, I'm going to take a quick drink of my Pepsi first. Of course, you got to take I said Pepsi to make you realize I'm not day drinking on an EMS show. But you don't know. You can't see what's in my cup, so I guess that was a pointless effort to make. But I was talking with some different people, and we're hearing different stories about how crews, and this is a age-old tale, right? I saw it myself when I was in EMS, of crews who don't work for the fire department, right? A lot of counties in our area have a separate fire department from the ambulance service. It's either a private ambulance service or it's hospital-based. In rural counties, that seems to be the way majorly, right? At least in my area that I've operated in a number of about 5 or 6 counties, or maybe close to 10 counties that I know of. It's separate. The county runs the fire department. Sometimes it's mostly volunteer. Sometimes it's professional. But another service runs the ambulance, like I said, either hospital-based or privatized. And so that means I answer as an EMS medic, I answer to a whole different system of people than you as the fireman answers to. But to save money, and part of the whole deal with counties to save money is instead of having to build a whole bunch of ambulance stations when we come in to run your ambulance service, you're going to partner us with an ambulance or fire station, right? You'll move one of the smaller trucks or whatever and give an ambulance a place to park and the crew a place to sleep. And that's the deal with most counties. And I always try to make connections with people. I always try to go in and mesh and build a team and be a part of what's going on. So what I did when I was at the fire station was we'd go in the morning, and I learned their rules and found out about sleeping during the day. I just flat out asked, what's your policy on sleeping during the day? Sometimes I get ugly stares like, oh, you're so unprofessional. Why would you want to do that? And I had somebody say, you're unprofessional. I'm like, screw you. I have to get up and run 5 times more calls than you do after midnight. So F you, But there's what people understood. And I'm just finding out what the rules are because I want to abide in the fire station like the firefighters. There's nothing worse for building a team than somebody who doesn't have to play by the same rules as somebody else in the same house. That's actually the opposite of building a team. So I did find the people who understood. I'm just trying to be part of what you do, trying to make things go on. I understand I don't answer to you. I don't answer to your chief at all. That basically I can tell you to go to hell, and the worst you can do to me is make a complaint to your supervisor, who will then talk to mine. Or, I was actually in the station with the chief of there's battalion chiefs or whatever. I think I was in the battalion chief station. He had supervisors, but he was like, for the day, he was it for everybody else. So if I pissed him off, he would just go directly to my supervisor. And so he could complain, but that's it. I mean, that's all you could do is you could complain to my supervisor. You couldn't actually do anything to me. That if it got bad enough, you could say, I don't want them at my station, and that would do it. Now, unfortunately, I've got something, I got to go do something that popped up. So I'm going to have to put a pin in that story. But next week, I'll try to follow up with building teamwork and telling the stories behind that because it's very important, and it's so easy to miss out on that. So I am going to take off, but thank you for watching and listening. I know it's been a short one today, and I only did stuff about students. Next week, I will talk about building teams and relationships amongst departments, amongst different crews and those kind of things. So try to check us out here every Thursday afternoon, 2:30 p.m. Eastern. I'm Charles McFall. Check EMS Underground is the name of the show. You can go to EMSU at GIEMS.com for the email for anything you want to talk about on the show. And that phone number there is how you find out about classes and ask for more things that you want us to talk about. So until next time, thanks for watching.